Board of Health. Any changes to the minutes? Okay,
Second.
all right. All in favor?
Aye.
Aye. Great. And at this time, I'd like to call on Laura Werner, our director, for the updates on the health department.
Thank you. So I just have a few items. Just wanted to lead off. I know top of many of our minds is what's going on with the Crozer Health System and the Prospect bankruptcy. And, we're still in a period of uncertainty. We don't know what's going to happen. Negotiations are very active. There's another bankruptcy court hearing tomorrow in Texas. We're hoping we learn more after that, but we continue to work very actively at the health department to prepare for the worst, since we still don't have the good news that we're anticipating or hoping for. So we're very, very actively involved with some of the work groups that the Department of Emergency Services has helped stand up and are prepared in that regard. We are still offering up our wellness line for questions and concerns from the community. I have to say there haven't been that many people that have taken advantage of that. We are also going to be hosting a health session that I wanted to just announce, a panel discussion to help residents educate themselves how to navigate the healthcare system during these challenging times, covering topics like your health insurance coverage, your medical records, transportation issues, all of those good things. So that event's going to be Saturday, April 5th. It's going to be at our Wellness Center in Yaden, also virtually from 12 to 2. So we will have information on how to register and learn more about that on our website. That's mainly what I was going to share on the Crozer side of things. Wanted to just let everyone be aware that the health department kicked off our childhood lead poisoning prevention education campaign last month. And we have some slides that we can show that kind of give you a little taste of that. We presented this to the maternal child health committee yesterday. That's the friendly monsters motif. So we're trying to let people know it's doesn't have to be scary. You can do something about this. And we're really hoping that people have seen some of the billboards out in the community. We have a lot of education materials that we're offering to partners, fun posters and giveaways and things, just trying to help people know what is the problem and what they can do about it. These are some examples, again, of the literature that we have and the target population and the key messages. And we have them in different languages as well. So I'll just some more about the campaign. Part of the campaign, we also we presented this previously, some of the lead poisoning data, so we won't get into that here. But we did develop some videos. We have one that's from a parent's experience and another one, I think, which we keep going a little bit further along. That's the billboard, is from our local code official from East Lansdowne. And we're really trying to get the word out about prevention. How do we go to the point where we're not poisoning the kids? So anyway.
I became aware of the lead issue when I attended a couple of the lead coalition meetings and found out that the numbers of the children tested in town were extremely high. Any house built before 1978 is going to have lead in it. There's an oil paint, so it's in your wall paint, it's in your trim. It's been covered many times over since then, but we have chipped and peeling paint. And lead is accessible. Children get poisoned. The ordinance states that every rental property, every daycare, and every house that is sold, every house transferred, must have a lead safe certificate. As a councilman, after we passed the ordinance for lead safe, we feel safer as a town, and we feel the children are more protected. Bottom line, our future is protected. I believe it's important for other municipalities to test for lead because children are being poisoned. If that's not enough reason, I don't think I can come up with one. You need to pass an ordinance stating that your rental properties and daycares and at least houses for sale must get a lead safe certificate. To learn more about the role of municipalities in primary prevention of lead poisoning, contact the Delaware County Health Department at 484-276-2100.
Thank you. And really, code enforcement, building inspections, all of that is at the local level in our counties. That's why we're working municipality by municipality to try to have an enforcement that can work to help do this primary prevention. Nope. Pesky phones, no problem. So when you're able to make a home lead safe before a child lives there, that's how you prevent the poisoning from ever happening. So that's our goal. And Robert Mold's just really been such a shining example of a municipal leader willing to take that extra step. So as the video showed, he was the first municipality. We also now have the city of Chester and the borough of Yaden who have taken these steps, and we're having conversations with others. So that's our goal. That's where all that is. On the opioid side of things, I know you've heard me talk about our public health kiosks, the test and code kiosks. So we have 3 of them right now, one that you would have seen as you came right into the building, one at our Chester partner, Keystone First, thank you so much, and another one at the Yaden Wellness Center. We're really excited to be able to launch 2 new ones, one at Delaware County Community College and one at 69th Street Terminal in partnership with SEPTA. So we're really excited about this. I hope we can continue this programming. But the big launch will be in a couple of weeks, mid-April. That coincides with our anniversary month. We are 3 years old. So we're always just like to make a little bit of a note that we're growing and toddling. And yeah, so we'll have our goal is to have a video that will kind of describe where we've been and where we're going. And it also is at the same time as, what is it called? Public health appreciation.
It's National Public.
There we go.
Yeah.
Thank you, Rose.
National Public Health
Week. And so as part of that week, we're going to be doing a video that we'll put out on social media with each one of our departments saying, this is what an environmental health person's doing. This is what someone in our, a personal health administration is doing, just to give that flavor again of who we are and what we're doing. So personalize it to some degree. All right, and the last item on my list was just a federal grant update. There's just so much going on right now in the news that we're all hearing about new executive orders and changes that are at the federal level. But as a county public health department, this does have impacts for us too. We have a lot of grants. We're really proud to be able to be largely grant funded, but that means changes in grants affect us deeply. And the most recent things that came out this week had to do with the epidemiological laboratory capacity grants, ELC grants that come out of HHS through CDC to the State Health Department to Delaware County. We don't yet know what's going to happen. We always knew that the ELC funding would go away. It was related to the pandemic, and we were expecting it to sunset in the next 2 years. But this may be happening more quickly than we anticipated. So we will be working on plans to be resilient and carry on. Okay, those were my questions. Do we do questions now or later?
We can do questions, huh? Any questions from the board? The questions.
I do have a question. I don't know if you can hear me.
Yes, we can.
Oh, okay. Laura, I just could you let us know what % of the budget is coming from the health department?
You mean from grants of our health?
Yeah.
It's
Yeah.
about 70%, I believe, around 70% funded, a wide variety of grants.
Wow. Okay. You do know that I heard that 12 billion is being taken away from health departments. I'm not sure if the Pennsylvania health department is impacted, but just thinking about that
Yeah, that's
and what that means.
national. It affects, I think, every state. I know it affects Pennsylvania.
Yeah. Mm-hmm. Okay.
And that's partly connected to the EL.
To the state.
Correct. That's absolutely part of the funding that they're talking about.
I know.
Yeah. Okay.
But that's all we've been notified of. Yeah.
Mhm.
Any other questions?
Let's put a fine point on that. I mean, when the pandemic was going on, so many things happened during the pandemic, but I don't know if you remember the details of just about 5 years ago at this time, and there was no laboratory capacity. There was nothing. Specimens were gathered, they were sent to health departments and then had to be sent to the CDC. And, you know, that's what this is for, to develop that capacity. So it's a real tragedy that this is being, you know, this is being undercut.
And it wasn't just about, it was also about the collection of the sample, like it was a whole thing about training and.
Yeah.
And I can tell you when the county started their COVID response, you know, it was really the Wild West of
Mhm.
trying to
Yeah.
get specimens.
Yeah.
You know, even where we had centers with, you know, long-term care centers with large outbreaks, we had no place to test. So, and with the world as it is right now, with all the other infectious diseases out there, it's not a good time to cut, but. So advocacy is needed. Thank you.
Thanks.
Okay, what, yeah,
Yeah, you
so
keep
we
on
can move
going.
into, keep going into our new business.
I guess, I just have a few kind of, the board had asked for just some general update about, some of the diseases of the week or, so, my presentation will come up. We wanted to start with measles. Measles is definitely on everyone's mind. I think that slide will come up in a minute. So nationally, there's 378 confirmed cases in 18 jurisdictions. That includes the state of Pennsylvania. I had to put the circle there because I had pulled this. This was a presentation the State Health Department Secretary of Health had given, and those numbers obviously keep going up. We just got alerted that there's Pennsylvania is now going to have its first travel-related and U.S. travel-related case of measles from somebody who was in Texas, the epicenter of where this is going on, who came to Bucks County. So it's not our county, but it's close by. So this is going to, that outbreak is going to continue to spread. Oops, sorry, can you go back just one, thank you. One thing that I really appreciated the Secretary of Health emphasizing was the percent of hospitalization of these cases. This is not a trivial disease. These 17% of these cases are getting hospitalized. And you can see what that looks like by age group. Very serious and again, preventable by vaccination. So anyway, that was what I wanted to share there. The next slide gives you a picture of what measles vaccination in kindergartners in the Southeast PA looks like. This is the data from the State Health Department's website. So you can map it out by county. You can see Delaware County is that purple line. We are seeing a decline in vaccination rates in children in most of those jurisdictions. Bucks is going up. That's the red line. They had been the lowest and now they're rising, but most of the other jurisdictions are holding even or going down. And that's something we're working really hard to try to address. And you'll hear some more about that. Thank you. Respiratory season has not left us all the way yet. Unfortunately, we are still seeing influenza and RSV. So this is some of the mapping from the state's dashboard. So you can see that. One thing from this slide in particular that I thought would be interesting to point out, you can see that this is when influenza deaths this year were actually higher than COVID-19 deaths. So that's the green line is COVID, purple is COVID-19. So it was a big year for that. And our wastewater, just in case you want to see what's going on with the viruses in our wastewater, this is from the Chester treatment plant that's part of a wastewater scan. Again, publicly available data, but you can see we're still having a lot of norovirus circulating and certainly, a lot of influenza. So, and we are still very much dealing with the bird flu. This is something that the State Health Department is working with the Ag and Game Commission on. And of course, local health departments have a job to do follow-up with cases if they've been identified for us. So there's healthcare facilities are being asked to subtype to try to help identify these cases early. The health department has activated at the state level, activated instant command system. We have not locally. We still have at this time no known human-to-human transmission and low risk for the general public, but we absolutely are trying to stay on top of transmission. So that was it for me. Thank you.
This was more than one death in Texas. Is there more than one? I thought I heard about this.
There was a Louisiana death as well. 2.
Yeah. Yeah, it's not benign in adults either. Measles is not benign in
Oh,
adults.
sorry, we thought you were talking about bird flu.
Oh.
Oh, the measles. I know. what- Oh,
Yeah, I thought there was a second.
I'm glad Carol's here. If no other questions about that, we can move right into more measles.
Well, I was just gonna note too, that just the pressure on the health systems, that we're still having constant levels of different viruses out there and the pressure it's putting on the health systems that have, are still, emergency room times are still very high. You know, that we're entering the spring, it's still, they're experiencing that across the region.
Yeah.
I got comment. All right, did you want to?
I would love to have our next speakers come up. Megan Shake is our interim director of personal health and administrator. I called you. I'm loving my words today. Interim administrator for personal health, and Carol Brown Collin is our nurse public health manager who manages our disease investigation group. So I'd love for you guys to come.
Sean, do you want them at the podium? Yeah. Okay. Okay. So you gotta go up, Victor. Poor Victor's tired of talking this week.
We're just making.
And we also added in a little bit of information about pertussis since it's something that we've seen over this past year. Okay. All right. Victor.
Yeah, what is really interesting here is distribution of measles and pertussis over time in Delaware County. If we look at the first one, we're looking at the number of cases of measles and pertussis. You're going to see that in 2024, a very large.
Excuse me, Victor, can we have phones turned off? I think we're, okay, please, thank you.
Yes, so if we look at pertussis, which is the orange bar, look how high it is, 216 cases. Compare that to before, very small numbers. Measles, we got one confirmed in 2023, nothing in the other years, nothing this year, knock on wood. And if we look at the next one, these are reported cases of measles and pertussis by age groups. I thought it was interesting to notice that pertussis, again, the orange, look at the age 15 to 19, a very large number. But when we look at measles, 0 to 4. So that is expected, but also interesting. Pertussis in other age groups, not very, very high. So these are data from the Pennsylvania Department of Health. They put together these files in SAS, and we download the files, and we create these charts, confirmed cases. And I think the last one is about race and measles and pertussis. Not a good deal of good information about race in these records because sometimes they don't, when whoever is reporting, they do not include race. But what we have, most of the measles cases, pertussis, white and less with the other unknown race and other. So that's what pretty much what we're trying to present here.
Thank you.
My pleasure.
Victor, I just have a quick question.
Yes.
How is pertussis looking across the state right now?
Pertussis across the state,
Mhm.
it's locally it's going down. However, don't forget, this has been going on, this cyclical measure, since the 80s and the 70s.
Mhm.
Every 3 to 5 years, it goes up and then it goes down for a number of years. Luckily, what's happening to us is decreasing number of pertussis cases across the board of the state and the nation too. But it will come back again.
Thanks, Victor.
Only that.
You want to advance your slide, you just said that.
Oh,
There you go.
thanks.
Hi, again, I'm Carol Von Collen, and I am a public health nurse manager for the disease investigation team. There are approximately 75 reportable diseases, and this team investigates all but STI, STD, HIV, and tuberculosis. The team consists of 4 investigators, and there's 2 nurses. One of the nurses investigates hospital-acquired infections and or healthcare-acquired infections, and the other nurse, excuse me, investigates lead poisoning cases and hepatitis B, perinatal hepatitis B. And that is the lovely team. What I wanted to present was a measles case. The last confirmed measles case that we had in Delaware County came to us the December of 2023 into the beginning of 2024. And this was an infant who traveled overseas with mom and older brother and spent a month over there. Became ill just prior to returning to the States. When they came back to the United States, 2 planes, 2 terminals that they walked through, ended up in Washington. Family member picked them up, drove them home, but in that process stopped at a family member, had dinner with the family, and then went home. Next day, the child was still ill, and they took him to Children's Hospital of Philadelphia. So the guidelines that we use are provided, the epidemiology guidelines are provided to us from the state health department and with the recommendations of the CDC. So case identification, and this is where the part is that there's most of the exposures happen. Unfortunately, these folks, they go into the waiting room, they're waiting there with other children and families, and that's where the exposures happen. So when there's a measles case, you're often not just investigating one person. This particular case, there were about 36 exposures that needed to be followed for weeks after the exposure. So it's case identification. They have to meet the clinical criteria, which is fever, runny nose, conjunctivitis, cough, and then the characteristic, days later, the characteristic rash appears, starting at the hairline and then descending through the upper torso at least, or the whole body. They'll do lab tests. The 2 preferred are urine and a nasal swab, and they investigate the vaccine status. But in this particular case, we already knew that the infant was not vaccinated. Case reporting, once we are notified, and I have to say everyone has done a really good job. The providers have done an excellent job in notifying us when there's these possibilities so that we can be on the lookout for them. So we immediately have an internal huddle with all of the players, and we also meet with the Pennsylvania Health Department so that we can discuss next steps. The epidemiology investigation, this is usually the information gathering, and it's the most lengthy part of it because we are reviewing all of the hospital records and interviewing the parents. And the interview is pretty extensive. And in this case that we had, mom and dad were extremely forthcoming with the information. Mom had dates, times, flight numbers, what time they arrived and left, and it was great. So she made that piece of it so much easier. And we knew that the source of the exposure was when they were overseas. The contact tracing, we sort of try to put them into 2 categories: high risk, low risk. High risk naturally are the people that are not vaccinated or under vaccinated, seniors, pregnant women, and anyone that is immunocompromised. Low risk, people that are vaccinated and because of the breakthrough, it's not common, but it happens. And these are the folks that we follow. And this follow-up goes on literally for weeks because of the long incubation period. Outbreak management, fortunately, we didn't have to do any of that with this particular case, but it's encouraging people to isolate and provide information about vaccines. We would do vaccine clinics and alert the daycares, the schools, the places where people would gather. The data collection, all of the information that we gather goes into the case and into the state system. Excuse me. We also notify our partners, the pediatricians' offices, and actually Victor had put things out, messaging out in the newsletter and that kind of thing. And there's also a media event as well. Ongoing surveillance, we continue to follow these cases, looking for any possibility of an actual measles case coming about from the exposures. And, reviewing the vaccination status of all of these folks continually. Post-investigation, we do yet another huddle internally and with the jurisdictions. Of those 36 people, the majority of them were Philadelphia residents, and there were about 8 from other jurisdictions. So we try to just grab all the partners and then have that last huddle to go over processes and see where we can improve. Next slide, please. And as you can see, it is vaccine preventable. First dose is 93% effective, second dose 97% effective. And for infants traveling, we tried to get the word out that they speak with their pediatricians too, because they can give the first MMR at 6 months to avoid a traveling child. Next slide, please. A pertussis case, which, as you know, there was a significant increase in pertussis cases over last school year. And it was the majority of the cases that we saw were high school age children. And the identification process was probably the most difficult because the first stage of pertussis is all cold-like symptoms. So no one was running to the doctors to be diagnosed with anything. Or they did go multiple times and were treated for other illnesses. But eventually, and it's very simple, it's just a nasal swab. And to mitigate the spread is just 5 days of azithromycin. They stay home from school, 5 days, they're good to go back. The problem that arises is that until they get to that point and they're coughing, they're contagious. So they're in school, they're doing clubs, they're in sports, they're, in close contact with everyone. The investigation process is certainly much less than measles. We interview the parent, and get all the information from the provider, which is usually just a doctor's appointment. The contact tracing, the CDC changed their recommendations for contact tracing for prophylaxis strictly to household contacts. And then we also tried to include if the teenage child had a significant other. So because they want the household folks to have prophylaxis, that created a bit of an issue because the pediatrician certainly was not going to write scripts for mom, dad, the grandparents, or whoever lived in the household other than their own patients. So it was recommended that they would contact their own PCP to get scripts for the prophylaxis. And it gets documented, like all cases, in the state system. the data collection, we also, because of the rise in cases, and it was across the state, we did have multiple conversations with the state health department. And they provided a lot of information about what was going on statewide. And the ongoing surveillance, we also contacted every school for every child that was a positive pertussis case, and provided, recommended that the parents were notified of these, that there was an existing case in the school at that moment, so that parents would know what to look for. And I am now going to, that's it for me, and thank you, and I'm going to turn it over to Megan.
That's good. Good evening, everyone. I'm Megan Shake. I'm the interim administrator for personal health. So as Carol was saying with pertussis, there are ways to prevent it. It is vaccine preventable. Children receive 5 doses of DTaP, with 1 dose being after the age of 4. When children are 11 to 12 years old, they receive that Tdap booster. Something that I found interesting was the immunity to pertussis actually starts to wane after a few years after getting the Tdap vaccine. However, the CDC does not recommend that you get a Tdap booster because you want to increase your pertussis protection. It's more to protect you against tetanus and diphtheria. There is a caveat: if you are pregnant, pregnant women receive a Tdap vaccine in their 3rd trimester, and then anyone that's going to be around the infant, taking care of the newborn, they are also encouraged to get a Tdap booster as well. And something that Victor actually sent over to me, it is recommended by the CDC that if pertussis is expected, or, they're assuming it could be pertussis, but the test hasn't come back yet, it's better to just go ahead and treat with that 5 days of azithromycin, and then you stay at home, and then the child can return back to normal activity. So I thought that was interesting too. So I'm really excited to speak about the vaccine initiatives and the vaccines that we have administered at the health department. Previously, before I came into this role, I was the maternal child health nurse supervisor, and a lot of our focus is vaccines. So I wanted to show a snapshot of a 6-month period. So I took August 1st of 2023 to February 1st of 2024, and then I took August 1st of 2024 to February 1st of 2025. I highlighted the MMR, MRV, DTaP, and Tdap vaccines, but I also gathered our patient totals of our school-age children, so birth to 18 years, and then also the PA required vaccines for school that we administered. So you can see that we've done a good job in increasing our vaccine rates at our Yaden Wellness Center, and that is through the hard work of everyone at the health department. Across the divisions, we've really work to increase our trust in the community and let people know that our health department is a safe place to be. So it's really exciting to see this, and I'm hopeful that we can continue increasing those numbers as the years go on. Some of the school-aged immunization initiatives that we have started, if you'll notice, our Tdap doses really increased. And again, Victor, he pulled some data for us, and it showed that adolescents in Delaware County, their rates of Tdap vaccine and meningitis, the MCV4 vaccine, were less than the state. So because of that, we were able to purchase Tdap and MCV4 vaccine and hold special clinics. So that is why we had such an increase. So we've partnered with Upper Darby School District. We held a walk-in vaccine clinic for them. For students that are not up to date on their vaccines, they get excluded from school. And the Tdap meningitis shot, you get it in 7th grade, and then a meningitis booster in your senior year. So seniors were getting excluded from school, being at risk for not graduating. So we held a walk-in clinic. We had over 90 families come to get vaccinated, and those students were able to return same day. We also went to Upper Darby and had a clinic at their gymnasium after school hours. We also have been to William Penn School District, and when we worked with them, we actually had the students pre-consented prior to the vaccine clinic, and we went during the school day. And that worked really well. 7th and 12th graders handle vaccines pretty much okay for the most part. But it was great because we were able to meet people where they were at. We were breaking barriers with transportation, families missing work, not getting paid. Students missed just a few minutes of class. So that was really exciting, and we hope to continue doing that and other school districts. The last school district that we worked with was Interborough. This was on a smaller scale, but they reached out to me because they had some students that were unhoused or had a lot of barriers to vaccine access. So we were able to take vaccine and get those students vaccinated. And they were all seniors, so that helped them stay in school and, you know, keep on the path to graduate. Our Vaccines for Children program is great. We have really been trying to build that as well. We've partnered with Murphy's Giving Market, which is a local food pantry. Our residents feel safe there, and so we're able to go to that location and offer vaccines. So we've had 3 vaccine clinics there. Centro de Apoyo is also another organization. They help migrant families in the Upper Darby area. So we went one evening to their business offices and provided vaccines. Our weekly clinics, we have clinic in Yeadon Tuesday, Wednesday, Thursdays, some evenings and some weekends. We've been trying to streamline our process, so we utilize our electronic medical record more, and we've also kind of cut down the redundancies in our paperwork, so it's easier for families to complete. So we're able to, instead of just seeing 6 patients a day, we're now able to see about 12 patients a day, and most of our days are pretty jam-packed. And we've also been seeing increases at our Chester office as well, which is exciting, because some days we go there once a month, and some months there will only be like 1 or 2 people, but now we have a full day. One other thing I want to highlight, I love bragging on my team. Marie Duray is our BFC compliance and IQIP specialist. And one of her duties is to process the data received from the school immunization law report, the SILR. And this report has to be completed by schools, and specifically school nurses, every December. And it gives a picture of what their vaccination rates are, where there are exclusions, so exclusions for medical reasons, religious or ethical. So this really gives us a good snapshot. Unfortunately, there are some schools that just do not complete this report at all. So the 2023-2024 school year, there was 24 schools that were non-reporting, but Marie really took it upon herself to educate. She got together with our school nurse liaison. They provided education. Marie has been a resource. She's even gone to schools to show them how to do this report. So this year, only 10 schools were non-reporting, so that was great for her work. But again, we really need our schools to provide these reports so that we can find the gaps and we can bridge those gaps in access to vaccines, and also just education of why we have that vaccine hesitancy too. So that's great. And then this is just some pictures of us at clinics, Murphy's Giving Market. This was the line outside our door at Yeadon when we had our walk-in clinic. There's the gym, and then that's one of our nurses with our like little vaccine cooler as we're heading to William Penn School District. So thank you so much. If you have any questions, I can happy to answer anything. Yes.
How do you get parent consent during those school clinics?
Yeah, so what we did was we sent home we provided our consent, our VFC eligibility and consent to parents, and they just fill it out ahead of time. And as long as they've signed I consent to have my child having these vaccines, we're able to use that and go to the school and give those vaccines that day.
Do the schools give you the list of patients that are not vaccinated?
So this is really an effort between the school nurses and the health department. The school nurses kind of do the groundwork for us. They know the students that need to be vaccinated. So they're reaching out to those families and letting them know, hey, the health department will be here. Because ultimately, school nurses want their SILR report to show 100% compliance with their vaccines. So they really helped us out with that. So they would bring the students to the office, and then we would vaccinate them.
Thank you.
Great.
I know, I'm sorry. So for measles, if there happened to be a measles outbreak in Delaware County for say, so in Texas, they were still encouraging people to get vaccinated, if they possibly were exposed, and do that vaccination within, I think it's 72 hours.
Yeah.
Is that right? So are you guys ready if that happened?
Truthfully, I think we would be. The biggest thing would just be getting the vaccine, but we have tons of blue cubes. Steph was a big part of the COVID-19 vaccine rollout, so we have, yeah. Mm-hmm. Yeah. Yeah, but I think really truly our nurses would be ready, especially with the outside events that we've done. We're pretty much a well-oiled machine, so lots of checklists and everything, but I definitely think we would be prepared.
Yeah, go ahead. Jay.
Megan, it looks from the graphs that you showed that Delaware County has fallen below the threshold where we would consider ourselves to have herd immunity.
Correct.
Can you put a number on that? I mean, what's the delta between where we are and herd immunity in terms of number of children that need to be vaccinated? I mean, this is how you're going to get there by, the work that you just described.
Right.
How much more do we have to do, I guess, is my.
So I'm looking at picture. We're at like 92.5% right now. Does that sound about right for kindergartners? And we need to be at 94%, I believe. So we're close, but we're not quite there. So again, it's just getting out and educating. And also I've noticed that families who vaccinated their kids with all the school age immunizations prior to COVID, a lot of them stopped for their younger children after COVID. So we have our Delaware County Immunization Coalition, Victor as well. We really are trying to kind of jump that hurdle of vaccine hesitancy through education, through personal stories that parents have shared. So it is a work. I don't know exactly what that number is. I'd have to find out, but we definitely are trying our very best to get people vaccinated.
Are you targeting it by school district? I mean, I imagine there's a distribution of under vaccination across the county.
So that's what the silo report helps us with that. So we're able to kind of see where those pockets are. So we have our eye on some school districts that we would really like to get into. We haven't quite yet, but we're working with the school nurses and the social workers, directors of student services. So hopefully we can get it in and offer vaccines. A lot of the students would qualify for the Vaccines for Children program. So it's a real thing that we could do, and we could show up and get people vaccinated. It's just sometimes taking that step to get in the door is a little difficult, but we've done it, and I know we can do it in these cases.
Who are the influencers in the districts that can help you get in the door? Is it the superintendent, or is it faculty? Is it, school boards? I mean, who need to influence?
Yeah, so definitely the superintendent, is over everything, but in most school districts, the director of student services is over the school nurses. So we have a wonderful relationship with the director of student services at Upper Darby, for instance. So it's just getting in and speaking with them, and also getting in with the nurses, but you have to have the parents buy in as well too, because if you don't have that buy-in, they're not going to want us to come and vaccinate them. And every school district is different. So it kind of depends on what their structure is and how kind of their hierarchy is.
Do you
So
set goals for, I mean, I know you want to get back to herd immunity, but
Right.
What's your goal between now and, July of 26 or? do you have a-
that's a really good question. We are always hitting the ground running. I think it would be a good idea to kind of set more of a numerical. We have goals and Achieve It. This is like a program that we keep track of what we've been doing. But yeah, I don't know if,
One, I don't know if I pull it off the top of my head, but I know
Yeah.
there was a percentage increase. Yeah.
yeah.
Students not vaccinated,
Mhm.
and then trying to reach out, so we've been reaching out to different people in the community that can support us. I'll give you an example. Meg Grant has a great connection at one of the schools we were trying to get in touch with. So she's now connecting us with them so that we can get them to that school district and get those kids vaccinated. But what I'm hearing from that school district is that kids are vaccinated,
Mhm.
that they're not updating their system time. So there's a disconnect, so what we want to know is if this is an action.
Mhm.
So there's a little disconnect between some of the school districts and what we do for them.
Right. And I will take from that, this is my shameless plug, but in the state of Pennsylvania, it is not mandatory for providers to enter vaccine records into the state system. The only people that have to do that are people that provide VFC vaccine or adult 317 vaccine. So our state record isn't exactly 100% accurate. So we do our best to enter all of our patients' history into peers so that they have a good record. But until we can have a true state system, it's very hard because tracking down records and providing, you know, families with records, especially as Crozier is closing, we've had more calls about, can I get my vaccine records from you? They told me call, you know, but it's just, we don't have that state system. So, and we have peers and it's a great platform. We just need people to put in the history. So.
Inaccurate because it's only what the data was put into this year.
Yeah.
We could be accurate, we are not.
Right.
But it does seem consistent with trends in many places. You've got a lot of
Yeah.
headwinds, so thanks for the great work you're doing.
Thank you. Appreciate it. Anybody else? Oh, okay, Victor. Yes.
I'd like to say that.
Yeah.
That I admire what they do because it's not just vaccinated. They check the dosage, the label, the records. Then you have to deal with the child, which is not standing still. In many cases, they're not very happy about the whole idea. So my congratulations. I would also like to say that in 2003, there were 8 cases of measles in Delaware County. But the ages, compared to 2023, 12 to 17.
Interesting.
Yeah.
So it's very different from
Mhm.
2023. And most experts recommending that measles outbreak to go after the unvaccinated and vaccinated. Congratulations and my appreciation.
Thank you. Thanks, Victor.
Yeah.
Thanks.
Thank you so much. A great presentation.
Mhm.
Yeah. Thank you, guys.
I always learn so much from everybody.
And Carol, just a point of clarification, the child that wasn't vaccinated was too young to be vaccinated, right?
When child left,
Mhm.
on to travel, he was only 5 months old. So he was appropriately unvaccinated. But we did really try to get the word out, once that sort of happens, that they can start to
Yeah.
vaccinate. The downside to that is that once they get that shot, they still need to get
Sure.
the one after 12
Right,
12
right.
months.
Right. Right. That group is so vulnerable and the child was lucky that it wasn't more serious.
Very, very. But again, mom and dad. were
Yeah, yeah.
So fortunate. It wasn't like,
Yeah, we're gonna really have to be mindful of this over the next couple of years because we have some big international events coming to the region. And vaccination histories will be unknown and people will be perhaps traveling with measles, who knows?
was actually just
Also, PJ, I was talking to Laura about this, but I was reading an article about people that get measles as a child, and then there's a latent
Yeah.
issue of kids as teenagers who suddenly develop a severe neurological.
A severe neurological condition. Yeah, the impacts of measles, can be really profound from, relatively early onset death, as we saw in Texas, to neurological impairment early on, hearing loss, and then later on, there's this late SSPE, I think is the shorthand for it, but it's a later neurological development that occurs in the teen years, sometimes late teen years, but this is not a benign condition. And we talked about this here a few years ago when someone asked, what's the big deal? We had 9 cases. Well, it didn't take very many cases to yield a death in Texas. The sequelae can be pretty serious. And when it was widespread, and we forget about that because vaccinations work. And we forget about what it was like when kids couldn't be vaccinated. And, we have a birth cohort in the United States of about 3 million babies every year. And they all would get measles back in the 1950s. And 1% would die. And, and many, you didn't die. Yeah. Yeah. So it's,
Well, in 1900, 1 in 5 children died of vaccine preventable diseases.
Mhm.
So it's come a long way. That's our vaccine for today. Okay, anything else from the board?
No comments.
Tony, are you good? Okay, so at this time, we'll allow for public comment. Just a reminder that we do have the 3 minutes. Please give your name and are you saying just the township? Township, yep.
I just want to apologize for my phone. I thought I thought I was not doing right. I kind of turned it off. It was coming back.
No,
Okay. No
Yeah.
problem.
we
No problem.
appreciate it. Okay. Anybody else? Okay, so not seeing any additional public comment, I call for adjournment. And our next meeting is June 12th here in the County Council room. Thank you all for attending.
Thank you.
Thanks.